There are 7 different types of scans that you could encounter when you have head or neck cancer. The first 2 are sort of exploratory or diagnostic scans. The first one being when your doctor uses palpation and visual examination of your tissue. My dental surgeon often started his exam with palpating my lymph nodes around my neck, and then, of course, looking into my mouth, always observing. You have lichen planus, and I again always said, I know what can we do about it. So palpation is a good initial exam for a skilled doctor. They can feel if you have a lump or a tumor anywhere in your face, if the tissue doesn't stretch just right. How you open your mouth can be an indication of oral cancer. If it involves your joint, then you cannot open your mouth very wide. But mostly visual examination of patches, redness, white patches, ulcers, etc. Anything that doesn't look just right, discolorations or so, in your mouth, that would be the first stage. Even your hygienist is skilled and trained in doing that, so let them do that. The second method of screening for oral cancer or using a particular type of scan is there are several different lights or like a wand that can be inserted into the mouth, and it has a blue light or a white light or green light, and it will intensify tissue that is not considered normal. So there are different names for those instruments. Common are the Velscope and the Oral ID. Velscope uses blue excitation light in the oral tissues, and anything that looks very dark would not be considered normal. Sometimes these things use fluorescent light, and it will show up to your doctor just looking different than normal tissue. There are also Visi-Light and Identify, which are different roles of operation. Some of these lights use a sort of fluorescent mouthwash that you use first before the light, like a little, imagine a flashlight shining into your mouth. So those instruments can be used for visualization of, I don't necessarily want to say cancer, but abnormal tissue. Not every dentist uses those. I have not found anyone yet that I talked to who had cancer that they had a dentist that used it, but they do seem popular in some areas. Next on the list of scans that you can have for oral cancer, number 3 is ultrasound. We all have heard of ultrasound. When you have a baby, when you're pregnant, you use ultrasound to get a visual of your developing baby. Ultrasound is very non-invasive. It doesn't use any x-rays, it doesn't use any dye. It uses, as the name says, sound waves going through your tissue to make a visual image. Ultrasound is most often being used to visualize the lymph nodes to see if there are, anything that looks different from normal. Ultrasound can be used when you have a biopsy. It's called ultrasound guided biopsy. Ultrasound is good for the initial detection of your head and neck cancer. It can also, in combination with a Doppler, be used for measuring the blood flow through the tissue. Next up on my list is number 4, X-ray. I think probably everybody who's listening has had a chest X-ray just to check for lung cancer. Again, checking for any abnormalities. The X-ray by itself does not give such a detailed picture, but it's often used as the initial scan for things like lung cancer or bone cancer or breast cancer. Again, X-rays are often used for the initial diagnosis of any abnormalities or broad area cancer in your body. Number 5, the MRI, magnetic resonance imaging. As the name implies, this machine uses very strong magnets to make an image of your soft tissue. It is mostly used for prostate cancer, breast cancer, anything large and soft tissues, but it can be used for head and neck cancer. Problem with the MRI is that you cannot have any metal in your body, like any pumps or a pacemaker or screws in your broken shoulder, things like that. Any metal will prohibit you getting an MRI. MRI gives a fairly detailed picture of your soft tissue, not the bones so much. Again, MRI uses magnetic fields and radio waves to provide a detailed image of your tissue. MRI for head and neck cancer is of particular interest when you have a cancer that runs along nerve tissue. The MRI will show that. Next on my list, number 6, CT scan, computed tomography. Maybe most of us for head and neck cancer have had CT scans, which are fairly quick. They do include a fair amount of radiation. Probably we all are subject to radiation from the environment. The radiation is often measured by hours, days, or years compared to environmental regular radiation, depending on how high you live. So the CT scan is probably comparable to 3 years of regular radiation from your environment. CT scans is particularly good for colon cancer, lung cancer, bone cancer. The CT scan uses X-rays to give you a detailed cross-section of your tissue. So imagine it takes a picture and then a little lower it takes a picture and a little lower it takes a picture, so you eventually can calculate a 3D image of your inside. CT scans are most often used to assess the location and size of your tumors, and it will always be used for a quick assessment whether your head and neck cancer has spread to the lungs or other tissue. Number 7 on my list is the PET scan, positron emission tomography. Say that's 3 times. So where the CT scan gives you a very nice structural image of the structure of the cancer, whereas the PET scan gives you a functional image a possible cancer. Before the PET scan, you are asked not to eat, not exercise heavily, have a good night's sleep, and before the PET scan, the way it works, you are given a sugar solution with radioactive sugar that you drink, and then you go into a machine that takes the picture. The CT scan will show you where the tissue uptakes that sugar. Cancers are really hungry for sugar, so it will show what tissue apparently took up the sugar that you took, and it can show the areas that take up the sugar will light up like fluorescent on the picture. So some areas will light up automatically because they always have higher uptake, like your intestines probably will light up with the PET scan. Some brain areas will light up with the PET scan no matter what you do. But I think it gives a really detailed picture of where your cancer was, has been, or where there's a higher uptake of the sugar solution. That is a red flag, so to say. Hey, I hope this helped for me. I was really confused in the beginning. What are all these different scans? CT scan, PET scan, ultrasound, and so on. So, if I would do it over again, I would say I would ask for an ultrasound first, because that is a cheap procedure, fast, and doesn't cost an arm and a leg, and it's not hurtful. It doesn't hurt your tissue. And with that, you can already see some stuff. Alright. Take care, folks. See you again. Bye.